welcome to Instagram Live. I'm Dr. Sonia Batra from the Doctor's TV show, and thank you for joining us. I'm here with Joseph today, and live in front of you, we're going to be addressing some of the dark hollows he has under his eyes, or dark circles, which Joseph, as you can see, is handsome and he's young, but he has had this for years. This has been more of a genetic issue for you, correct?
Yeah, it's always been a genetic issue. My mom's had it, grandparents have had it. It's always just run straight in the family on my mom's side.
Yeah.
And it's like, doesn't matter how much sleep I get, doesn't matter any of that stuff, which is always weird to me too, because I always thought it was like sleep as opposed to anything else.
Mm-hmm. And it's true, when you sleep, that's when your skin is restored. So if you're not sleeping well, you're going to look more tired. You're going to get more collection of that duskiness and that vascular pooling, which makes you look like you have dark circles. But I agree with you, for you, it's not how much sleep you're getting or how tired you are. It's really more structural, because you can see here that he has this trough that's a little bit shadowed and a little bit below the level of the fat pad under his eye and the cheek. And that demarcation of that trough is what people just on their own sort of interpret as a bag. And then it extends out here. There's a little bit of flattening even up on the cheek, and then a slight bit of flattening even into the top of the cheek. So when one of the ways we address this when we treat this is we often will think about just propping this up. So what I'd like to do today is actually put a hyaluronic acid gel, which is a filler, to kind of smooth this demarcation and prop this up. So we're going to work in this triangle here just to make you look a lot more rested. Now the goal is we never want to overdo this, because we don't want you to look puffy or like you have allergies or over plumped, but we just want to bring that deep trough up to a little bit more shallow area so it doesn't catch the light in the same way. It's not as shadowed, and it's not interpreted by people as a bag. You look more rested.
Gotcha.
So what we're using is hyaluronic acid. It's a sugar gel filler that's naturally found in the joints, but it's obviously from a pharmaceutical company in a syringe, and it lasts about a year in this location. So I know we already put a little numbing cream on you just so that it doesn't feel too uncomfortable to do the procedure. The filler itself has a little bit of anesthetic in it as well, which takes the edge off. But the interesting thing to know about it is going to attract water. So hyaluronic acid as a molecule is like a sponge. It attracts many times its weight in water. And so initially you're going to look great right when we do this, so we'll show an immediate before after of what we're doing, but you should expect to swell for about 2 to 3 days.
Okay.
And ways to minimize that are to avoid things that in your blood and make you more prone to bruising and swelling. So medications such as ibuprofen, naproxen, even things like fish oil and vitamin C that make you more prone to bleeding and bruising. Really bad idea, certainly in the week prior to this procedure, as we have discussed, but even for 48 hours afterwards. We usually tell our patients to avoid heavy exercise, saunas, steam rooms, things that open up the vessels and make you more prone to bruising and swelling. So I have my assistant Rachel with me. She's going to come over here too. She's going to help me with a vein finder light.
Oh, fun. Okay.
Which I like to use because it helps with an infrared, very safe wavelength, show us where the veins actually lie under the surface of the skin. So this we like to use anytime we're going in an area that anatomically is a little bit challenging, and under the eyes especially, there are a lot of really critical structures and blood vessels that we definitely don't want to hit with a needle, so we like to use that as a tool. So you ready? Do you have any questions for me?
No, let's see what that does. It's pretty cool.
This is super cool. All right.
So we're going to put this up. And I'm going to have you turn a little bit towards me and bring your chin down just a little bit. And Rachel, I'm going to have you bring the light up for me for just a moment. And so in real time, what you can see is the shadows are areas where he has blood vessels. So when we place the needle, we're always trying to go in the pink or the red area to avoid those blood vessels. And then the placement for this filler is really kind of right down on bone. And what I'm trying to do is just prop things up. The injection amounts are very small, and we're just kind of going right in here. I'm going to mold it a little bit. And you can even see from the first injection that it's come up a little bit, and we're just going to follow that trough all the way through. How is that in terms of discomfort? Is that pretty tolerable? Is it feeling okay so far?
Yeah, it feels okay so far. It kind of feels like you kind of like get a little pinch.
Like a little pinch,
Yeah,
right, when the needle
crazy.
goes in?
Yeah.
It's not too bad. And the nice thing about this is I'll show you in a handheld mirror right when we finish. It's kind of instant gratification because it props up the skin in real time as we're injecting.
Wow.
Yeah. And same thing here. She'll look a little closer in.
So I have a question about what
Sure.
actually are the dark
Let's go.
circles? Like, I know that they're hereditary, but is it just thin skin? Is it nothing underneath the skin?
So there are two reasons people get dark circles. People like me who are of Asian or Middle Eastern origin often will have pigment deposition there, so it is truly darker under the
Okay.
eyes. And so that's one more genetic reason for dark circles. The reason I think in Joseph, though, is as I'm propping this up, you'll see there's actually no pigment here. The skin is the same color as the surrounding skin. It was really more shadowing because of the depth. Now, the other thing to know is, we'll go up here, is that the skin under the eyes is really thin and really vascular. So sometimes you can even see the blood vessels there. And when the blood pools in those vessels, it can also give you kind of a bluish tint or hue. And that's what we often see when someone hasn't slept well.
Okay.
Because they get that vascular pooling, or when someone has really bad allergies and it looks like they have dark circles. Part of that is from rubbing your eyes, which will increase the pigment deposition. Those are called allergic shiners. But part of that is also just the vascular pooling due to allergies, and that also makes people look more tired and like they have bags under their eyes. So the genetic component for Joseph is more from the volume, because his structure, like his mom's, like he said, is not as propped up, so it looks kind of hollowed out. In many people who are more olive toned or pigmented, the dark circles is true pigment, and that's a genetic predisposition as well. Because you said it was your mom, right?
Mhm.
Who gets this?
Yeah.
Okay, perfect. And relax completely. We're going to do one more little shot here. And then, so we like to do a couple things. We like to use the AccuVein vein finder just to kind of minimize the likelihood that I'm going to hit a blood vessel. But we're also in a room that has a blood vessel laser. So if it turns out by accident, even despite using the vein finder, we hit a little blood vessel, we have the ability to use a pulse dye laser, which will clamp it down and also reduce the likelihood that he would get a true shiner or black and blue mark from this treatment. Because as you can imagine, around the eyes, there are just a lot of blood vessels. That's why people get black eyes so easily from an injury or from trauma. So it's nice to have a couple safeguards against that. And like I mentioned, it helps a lot if someone hasn't taken a bunch of blood thinning medicines before we do this procedure for about a week, because then they don't bruise and swell as much. So that eye looks pretty good to me, and you can even see kind of one side compared to the other. Just I'm going to show you for a moment in a handheld mirror, so you can see.
That's good.
Yeah, so it's instant, right?
Yeah.
It's super
Yeah, it really
fun
is nice.
that you can see. We didn't try to alter him. We certainly didn't try to make him look puffy, but what we addressed here, and I can actually show you this, is we tried to just prop up the depth of this crease here. So it's not, if you compare the side we haven't treated yet, but we will in just a moment, you can see there's a deeper trough there. It looks a little more shallowed, and it looks a little more dusky because the skin isn't as propped up. You're seeing some of the blood vessels there. He's a little red from the actual injections, but what I think you can see right away is there's not as much demarcation. It's just smoother and a little more blended. And the nice end result of that is when people look at you, they're not going to know what you did. It's not a really obvious, like, oh, he definitely put filler under his eyes, unless they watch this video, they'll know. They're just going to think that you look more rested and you look like you got the best night's sleep of your life, or that you've been on vacation. So that's one of my favorite aspects of feedback, that people will come back and tell me after they've had this and it's settled. They really will get all these comments from people about how great they look, and people say, hey, did you change your hair? What did you do? But they can't quite put their finger on why someone looks better. And that's kind of always the end goal, is that it doesn't look obvious. It's a very subtle but very gratifying sort of anti-aging and rejuvenating thing to do. So now we're going to start on the other side, just so that we can bring this side up to match.
You can really see it side by side.
Yeah, and it's nice to see the side-by-side because it is a subtle result. So it's the kind of thing that once we do both sides and they match, people often kind of forget and they don't know what we did. So it's kind of nice to see it in real time. We all kind of, once things are symmetric, it's harder to see the difference from before and after.
Now, can doctors put too much filler under your eye for this reason? I mean, they're like to get when they're going to get this done.
Absolutely. So when you're going to get this done, the goal is always to be conservative, and less is more. Because you don't want it to become what we call convex, or raised above the surrounding skin.
Right.
Because what happens then is you just look like you're having an allergic reaction. You don't look rested at all. You just look puffy and swollen, like
Right.
you've been crying or having really bad allergies. And sadly, I think everybody's seen a bad example of that, where someone looks really puffed up and sort of bloated under the eyes. With this treatment, less is always more. And the other critical thing was this, is remember, this looks pretty easy. It looks like I'm just jabbing him with needles. but you have to know the anatomy in this area. This is a really tricky area with a lot of important blood vessels and nerves. And you should never, ever have someone who's not trained and fully qualified to do this type of procedure do something like this near your eye. Because injecting into the blood vessel can threaten your vision. It's a really, really dangerous outcome. So you want someone who really understands and knows the anatomy of this area, who knows where the blood vessels lie for sure, and who's experienced with this. That you're not the first person they're sticking a needle into. You have to be very careful, and that's true of any cosmetic procedure. Because as we're doing so many more of them, they're accessible, and people see them on Instagram, and they think, oh, that looks really easy. There's a lot of training and experience that goes into any procedure, and you want to make sure the practitioner has actually had that before they're doing anything on you. That's for sure. So, short answer is yes, you can do too much. It can look very unnatural. And the nice thing about this filler, in particular with hyaluronic acid, is it can be dissolved. So there is an enzyme called hyaluronidase. So if you're ever in a bad situation where you've had a hyaluronic acid filler and it just doesn't look good and it looks too puffy or unnatural, rest assured there is a product that you can use to bring it down and to dissolve it. So at least there's that safeguard with this particular class of fillers, for sure. Just how are you feeling?
Good.
Yeah? What did you think of the one side compared to the other?
I loved it. It was interesting just to see the difference, but it was like you said, it was like subtle in a way of like, oh, I looked more rested in that eye, and the other eye looks like, oh, I just didn't get sleep. It's like pretty cool.
Yeah, it's really in real time nice to see that comparison.
Do dark circles get darker as you get older, or is it just because you lose volume in your eye? Is it true?
That's exactly right. So as we age, we sadly all lose that substructure and that volume in the face. It's one of the hardest parts of aging. It really is, because you lose bone, you lose muscle, and you lose fat. And the skin itself becomes less elastic. It starts to sag. And so anywhere that you're already losing volume becomes accentuated with time. And then the corollary is that people like me, who also have a tendency towards pigment, as we age, we have more discoloration and pigment as well. And that's why any of my patients watching this know I'm a complete fanatic, if not Nazi, about sunscreen and how important it is to always wear your good zinc-based sunscreen, rain or shine, to prevent that discoloration, which is so aging.
I learned that from you. A mineral-based sunscreen is the best. Zinc-based.
And that's the last one. I'm going to mold this a little bit.
Okay.
And then I'm going to show you in a mirror. But one thing I always like to point out to people is I purposefully have left you with some trough. We can't totally obliterate it and get rid of it, or you will look really unnatural. But what we did try to do is just bring it up and make it even so that you look more rested. Now the good news is you're not bruising at all. You can take a look in the mirror and see.
So funny.
Yeah, it's really nice. And so you said it would last about a year.
This should last about a year, and the reason for that is it's in an area where he's not going to be moving. It's right above the bone. Generally, when we put filler in areas which are really mobile, like the lips, for example, you metabolize them a little bit more quickly. But somewhere like this, where it's going to stay right where we put it and we placed it fairly deeply, it usually lasts about a year. And then gradually that enzyme I was mentioning, hyaluronidase, we already have that in our systems because it's what breaks down the hyaluronic acid in our joints. That goes in and it'll metabolize and break down any outside source of hyaluronic acid as well. Any other questions?
What's the best way if I already have the dark circle aspect there, like anybody who has dark circles, what's the best way to end up lightening those? Is there like any type of creams or anything anybody can use that can help with that?
Yeah, absolutely. So if the dark circles are more due to shadowing, and especially many of us have herniation of the fat pads behind the eyes, and that's what gives you that really puffy eye, then I always tell people, yeah, use an over-the-counter product with caffeine in it because it's basic and certain doesn't tamp things down and make it a little less puffy so that you don't have quite as sharp a bag. There are many products now on the market that actually form a very interesting film on your skin that temporarily will tighten the skin.
Okay.
Yeah, that's with Trixie 5, or there are many other branded products that do that. That's for more of like a quick fix. In the long term, if you're more prone to discoloration on the eye from pigment, you can get a good, very safe lightening cream, some of the really common active ingredients to look for are kojic acid, you can get vitamin C, you can get a very gentle alpha hydroxy acid like glycolic, even retinoids, which are good cell turnover agents, are all great ways to address pigment if it's causing discoloration on the eye.
Okay, great.
Yeah.
All right.
Well, thank you for joining us for the Instagram Live. Thank you, Joseph, for sharing your experience. Thank you, Rachel, for the assist. And thanks for joining us.
Thanks. Bye.
Bye.